Yes, welcome back to Bella Unwind with me, Sarah Ibrahim. So now, the eyes, they pull people in and we see the world. The nose, we smell things, great things and horrible things too. It's quite a sensitive topic. Yes, pun intended there. Anyway, my first guest for today, joining me is a very lovely looking lady. You're looking wonderful today, is Datin Swanee Teh. You are a pharmacist, Datin. So do I call you Datin Swanee or do I call you, what do you prefer?
Please call me Swanee.
Swanee?
Yes.
What a cool name. Where are you from originally?
From Klang. I'm from Klang.
Okay.
But my parents probably have a bit of sense of humor. They were hippie people.
Really?
And the name comes from an American song, the Swanee River.
The Swanee River. There you are gliding along.
I know.
And then you just came out of your mom and that was it. Now, you are a pharmacist and you've been one all your life.
Yes.
And where did you study to become a pharmacist?
Well, I was studying at the Welsh School of Pharmacy in Cardiff.
Wow.
And I have hospital experience behind me.
So did you come out speaking like a Welsh person?
It's difficult. Yeah,
they do speak through their nose a bit, don't they? Those Welsh people.
Excellent.
No, Irish a bit lah, mixed with the Banja.
Okay.
Now, speaking of noses and accents, etc., the reason why you're on the show is to help us understand our noses, right? What is it called when somebody loses their sense of smell, Swanee?
Well, as you were saying earlier, there is a term when somebody cannot see, and that's blindness.
Yes.
If somebody cannot hear, it's deafness.
Yes.
But when somebody loses their sense of smell,
it sucks.
Yes, but nobody really pays attention.
That's true.
And nobody really sort of extra empathetic or sympathetic about it. The term is actually hyposmia, a partial hyposmia, a partial loss of the ability to smell, or anosmia, which is a total loss of ability to smell.
Oh no, and I'm assuming, correct me if I'm wrong, hyposmia is something that happens like when you have a flu. You know, when we get the self-summer, usually we can't, bau hilang, taste goes away as well.
Exactly.
So that's a temporary thing. Is that because of a virus and stuff and
well,
so on?
It could be an infection setting in within the nose. If I could show you a picture of the nose.
Let's take a look at this. Thank you for bringing in an actual photo for us so that we can get it up close. And okay, go for it, Swanee.
Right. Well, the nose is actually more than just two orifices within the face. It sits at the top of our palate over here, the lelangit, and actually at the base of our brain. This very special position of the nose enables it to breathe. Humans actually have to breathe through their noses. We don't normally breathe through our mouths. That is actually a learned consequence. So when we actually breathe, it goes through the nose and into the lungs.
Yes.
A very important organ which cleans the air that we breathe, humidifies it so it's warm. Yes, because we can't take in cold air. And the sense of smell is right here at the base of the brain.
At the base of the brain. A lot of people don't know that. They think, like I used to before I studied biopsych, that you would imagine that the sense of smell is just in your nose. So it's interesting that it is connected to the brain. So some form of brain damage can actually cause you to lose your sense of smell, right?
Yes, exactly.
That's quite a dangerous thing. So let's just go back into the function of the nose. So it traps germs, etc.
Yes, there are fine hairs called cilia all along the nose, and it traps dirt particles, dust, so that it doesn't irritate the whole breathing.
But when we get like a flu, right, Swanee, what happens? Why is our nose running all the time and stuff? What's going on there?
Well, the nose produces about 4 liters of mucus every day.
Every day, irregardless?
Yes, day after day.
Where's the mucus going?
We actually swallow it without even knowing.
Gross.
Yes.
Oh, what? But it's a natural
way to lubricate the whole nasal olfactory system. And mucus clearly actually looks like this.
Okay, now this is absolutely gross, okay? I've never seen such a thing in my life, but on set today we have actually got mucus. Please don't switch off and continue with us, because there's a good reason for that. Can you please explain to us, Swanee, what is the difference? I'm assuming these are 2 different types of mucus?
Yes. Well, clearly, well, mucus is called snot as well, in a layman term. And And 4 liters of clear mucus is produced by the nose, which we swallow every day without even knowing.
4 liters a day to clean out our nose.
To breathe.
It's our filter lah.
Yes,
okay.
precisely.
That's if it's clean lah.
Yes.
Okay, so when it's hazy and the weather's horrible, or you're around people who smoke, which is a nightmare, it turns like
yes, it turns
the other one.
Yes, green when it's infected, whether it's a viral or a bacterial infection.
So why does it turn green?
Well, the bacteria actually feeds on this mucus, and it then creates an infection. So green is the color that is part of the metabolism.
Green is a sign that there's an infection then.
That's right.
What's yellow? Because there are different varying sort of degrees. It goes from clear to yellow to green to brown, I think, right?
Yes, so we've got
How come
chart.
I know this? This is very strange.
Excellent.
Oh, it's studies. Okay, okay.
Yeah, so these are the
like
different...
I'm examining it at home.
These are the different colors.
Okay,
So,
let's have a look in the camera if we can get a close-up of this again.
Yeah.
Here we go, Swanee.
So clear is healthy, is fine. And you've got a range of colors, as you mentioned just now, from green to even red.
There's red
Yeah.
and there's black.
Yes.
Oh my gosh, and this is, it says here, if you're a smoker, fungal infection.
Yes.
That's quite scary, isn't it?
Yes. So, yeah, it tells a lot. Our snot, our mucus tells a lot about our health.
Our health.
Yes.
So your average person will have clear, whitish. If it starts getting into yellow, Swanee, what does that mean? What can we do? Do we run straight to the pharmacist?
Okay.
Somebody like you? What do we do?
Now, there's a condition that infection happens to everybody, but there's a particular condition known as allergic rhinitis, in which the nasal mucosa is inflamed.
Right.
And people know this as sinus.
Why does that happen? How come some people have sinus, some people don't?
It's a genetic tendency, Sarina.
Okay, I see.
And it's hereditary.
Oh.
Yeah, so if a child is always sniffling or has a runny nose, or they do things like this.
Yeah, a lot.
Or like this.
Kesian, actually.
Yes, yes. Or over time, this chronic inflammation actually gives you a red nose.
Yes.
Or if you're putting on makeup so well, but some people can't actually do that.
Why?
Because of the itchiness that comes on.
I get itchy too sometimes, but not in my nose, like on my neck and stuff. That's probably a different sort of allergy. Right. But you know, I wanted to ask you, because a lot of my friends and stuff are taking anti-allergy tablets every day, popping anti-allergy tablets. How does that affect sinus in the long run?
Right.
Is that good?
Yeah, well, medication always comes with side effects in the long run, but for people to be able to go through the day, to cope, to feel better, to feel normal.
Then how? And they have no choice, actually.
Exactly.
Right. So let's talk a little bit more about sinus. So is sinus a disease or is it a condition?
Okay. Now the word sinus itself actually refers to the part of our face which are air pockets located here.
Okay.
Behind our eyes.
Okay.
And behind our noses as well.
These are the areas.
Yes.
Okay.
So although Malaysians say that they have sinus, often it could be just their nose being blocked, but not affecting here and having headaches and facial pain.
So you'd have to go for a scan to see if it's sinus?
You can, but you can also recognize the symptoms yourself.
Right.
By knowing whether you've got headaches or facial pain.
But sinus is something that people go through for a long time.
Yes.
It's not like a flu or an allergy, right? It's a different thing.
Exactly.
So once you're born with it, do you live with it for life, sinus, or is it curable?
Okay. Now, the reason why people have a sensitive nose or sinus problems, sinusitis, inflammation, is because their immune system are too sensitive, hypersensitive. So whenever they come across dust or temperature changes or
Pets
things
or whatever.
Exactly.
Sneezing. Joe, my brother's always like that. Every time he sees my cat Molly, he just sneezes.
Yes. So it runs in families, but not all the time in that there are a few genes, whether you inherit it or not.
Okay.
So your brother may have it, but you may escape.
Is there an operation or something that can be done to help somebody to not have sinus anymore?
No, unfortunately not.
Oh, no.
Unfortunately not. The operations that are often done are if there are polyps which are actually growth within the nasal passages.
Really?
Because it's so active, the skin tries, the mucosa inside tries to compensate by growing extra area to cope.
Okay, the body's amazing.
So much, 4 liters of this stuff.
Yeah,
Yes.
okay. So there's no operation, so what, you're sort of stuck with a life of taking anti-allergy tablets?
Most people do that. However, there are actually now research within natural therapies that are helping people.
Such as what can we take? Just to wrap this up with you, what are some of the tips
It's a herbal extract called astragalus.
Okay.
A particular patented one from Eastern Europe, Croatia.
Astragalus. Sounds like a transformer. Astragalus to the rescue. Okay,
Yes.
and it's a herb?
It's a herb now available in a capsule form, which goes to the root of the problem.
All right, okay, literally.
Yes, to calm hypersensitive immune system. So that when you come across dust the next time, no allergy symptoms will turn up.
No sneezing and berai mata and all this.
Yes, because your immune system is
Oh my God, my eyes are getting itchy now just talking to you. I'm just, oh, it must be such a difficult thing to live with,
Yes, it is, it is.
So, you're saying go take a look at this herb. This is the latest thing.
Astragalus, yes.
There are some people, though, just quickly, who actually go to remove a lot of mucus, isn't there? There's an operation, because I have a family member who actually had to do that.
Right.
Very painful,
It is symptomatic, not a long-term solution, because you have to go to the root of the problem, the hypersensitive immune system.
Anything a person can do going to the pharmacy besides taking over-the-counter meds?
Yes. Instead of just antihistamines, ask your pharmacist about Lactronel, which is the active ingredient, the patented active ingredient of astragalus.
Lactronel.
Lactronel.
Okay, I tried, everyone, to get as much as you can get in there, so you know what to do now. Get to the pharmacy, and hopefully you've got more information for those of you who are suffering from sinus. Thank you very much, Datin Swanee Teh. You know, do you have anywhere anyone can find you if they've got any questions? Are you on Facebook, etc.?
Nuvanta.com. So you're welcome to contact
Great.
us.
Thank you very much. Now we move on, talking about the nose. The nose is also linked, isn't it, Swanee, to the sense of taste.
Yes.
You know, if your nose isn't in working order, then you're not going to be tasting stuff. And when it comes down to taste, often we love to taste sweet food, don't we? A lot of people have sweet tooths. And we're talking about cake today, and not just any type of cake, but fondant cake. And the person who's going to be joining me, she knows all about this. I know nothing about fondant. Let's stick with it on Bell Unwind.